I'll be sharing with us a very important topic called rabies. But before I start, I would like you to subscribe, share, and hit the notification bell. Dogbite is also called rabies and is spread by rabies virus. Rabies virus is a disease that is almost always fatal once symptoms develop. Rabies is a zoonotic disease, that is, a disease that is transmittable from animal to humans. Rabies is caused by lesser virus, an infectious disease that can be transmittable from animals to humans. People are bitten usually by infected dogs or bats, or the pathogen enters the body through a wound if the skin is broken. I'd like us to pause for a while to share, subscribe, and hit the notification bell. It is a complex medical condition and unfortunately very difficult to treat. Once a patient or an individual shows symptoms of rabies, it is essentially 100% fatal, with the exception of a few cases. As a matter of fact, rabies is not endemic in humans. It's transmitted to humans from animals like dogs, also terms called rabid dogs, or from bats or some other animals. Actually, there are a lot of animals that can carry rabies virus, which is statistically strange. Usually, viruses are optimized for a particular species. The reason rabies is different, it is actually caused by a number of different viruses, not just one. But all of these viruses are in lesser virus genus with Rabies family. The infection works is when a dog or a bat or some other animal bites the individual. The rabies virus immediately infects the person's or individual muscle cells, replicate there, and then get into sensory and motor nerves, from where it travels by electrical axonal transport mechanism down to the spinal cord, from where it jumps across synapses into the next neurons, then travels up to the brain where danger is being exhibited. Theoretically, it is easily said, but in actual fact, this can take a long time because the incubation period will last for up to a week or as long as a year. Also, it depends on the part of the body the person or individual was bitten. The closer the bite to the brain or the face, the quicker it can get to the CNS compared to when bitten on the foot, because the axonal transport takes time. The long incubation period is very important to know because it is a time you can intervene with proper vaccination. Once symptoms start soon, it might be too late because the person will die eventually. Once this virus gets into the brain, it can affect neurons, and if you can have the opportunity of viewing or seeing some infected brain tissues under a microscope, you might see negre bodies, which are eosinophilic and aggregate viral proteins in the cell that clog together. So that is how it gets to the brain. But actually, once the virus starts replicating in the brain, it can now spread outward again. Brain biopsy post-mortem to see what happened. But either way, even if the individual had diagnosed the person while alive, there is no meaningful treatment to speak of since the symptoms have already or is already established. So the best remedy for rabies virus is early detection, thereby establishing early vaccination and treatment as such. I would like to pause for a while so you can subscribe, share, and hit the notification bell. Thank you. And the terms, I know many of us would like to know what does rabies means and where it comes from. The term rabies is derived from the Latin word rabere, which roughly means to be mad or to be rave. Surprisingly, in 2008, Germany was declared rabies-free. The infectious disease is common in most parts of the world. Only a few countries are free from the rabies. In a moment, I'll be sharing with us the signs and symptoms. But before I continue, as a rule, the incubation period for rabies, that is the period for between infection and the appearance of symptoms, is between 3 and 8 weeks, and very rarely less than 9 days. However, there are isolated cases in which several years pass and between infection and the development of symptoms. The duration depends on where the person has been bitten. The nearer the bite wound is to the person's head or spinal cord, the shorter the incubation period. In a few moments, I will be sharing with us the signs and symptoms of rabies. But before I do that, I will implore us to hit the notification bell, share and subscribe. The signs and symptoms may include the following: fever, headache, nausea and vomiting, agitation, anxiety. The person may feel confused, and the person might be showing signs of hyperactivity, and the person might be also show signs of difficulty in swallowing, that is dysphagia, excessive salivation, hypersalivation, fear of height, or the person will be fear of water too is another sign. Fear brought on by attempt to drink fluid because of the difficulty in swallowing. Also, the individual might be experiencing hallucination, partial paralysis, and finally insomnia. That is, the person might not be able to sleep. Rabies have different stages, and I'll be sharing the stage with us. The first one is preliminary stage, which is also called prodromal stage. At the beginning, the rabies is similar to a flu-like illness. The person will feel like he or she has flu. The patient feel weak and exhausted. They have headache, signs of headache, no appetite. Some even feel sick and hard to vomit. The area around the entry point of the virus is often tender, and the person feels a burning or itching sensation there. The second stage, which is intermediate stage or the acute neurologic period. At this second stage, the virus have entered the transmission of signals between the nerves, and the nerves cells become overly active and perish as a result. Because of the hyperactivity of the nerve cell, they perished. That is, they are paralyzed. Medical practitioner may make a distinction between two forms of the disease at this stage. The encephalitic form of the rabies mainly affect the brain, and as the nerve cells die, many people lose more and more of their body function, because normally the rabies virus affect the nervous system. They also show a marked fear of water at this stage. Just hearing or seeing water makes them restless, anxious, or even leads to spasm. In restless, also lead to spasm in the muzzle used for swallowing, because more saliva is also produced. Foaming at the mouth occur, where saliva flows out of the patient's mouth. Some of the patients with this condition are also afraid of drafts. The spasm can spread from muzzle used for swallowing through the whole body. The person's mood alternates between aggression and depression. The second stage of the rabies virus attack is also known as the paralytic form. Mainly affect the spinal cord and the nerves, leading to the muzzle and the organs. This form of disease is marked by abdominal sensation or muzzle weakness and signs of paralysis that can lead to difficulty with swallowing, but can also affect respiratory muzzle. The terminal stage, which is the last stage, at the final stage of this rabies, the patient or the part of the brain that control functions such as breathing or bloodstream fails totally, and the patient fall into coma. Death usually follows due to paralysis or paralyzed respiratory or cardiac muzzle, which is the fatal stage of rabies virus. The striking features of rabies is that in many cases only a few days pass between appearance of the first symptoms and the death of the patient. I know some of us be wondering, how is rabies transmitted to humans? But before I continue, I would like you to subscribe, share and hit the notification bell. When an animal has been infected, the virus replicates in the central nervous system of such animal, and also the virus enters their saliva. This is how the disease can then be transmitted to humans, in most cases through bites, because the virus is in their saliva already, and when it mixes with the wound inflicted on the skin of such individual, the virus is transmitted to the person. And such animal as dogs, fox and cat can be contagious for 3 to 10 days before they even show signs of the symptoms. Some of us will be asking, when is it we can see a doctor, or when are we supposed to see a doctor? It is very important to seek medical care if you are bitten by an animal or exposed to the animal suspected of having rabies. Based on your injury, also you're expected to seek medical intervention and decision in which the exposure happened to you, and your doctor can decide whether you should receive treatment to prevent rabies. Even if you aren't sure whether you have been bitten, seek medical intervention. For instance, a bat that flies into your room while you are sleeping may bite you without waking you up. If you are awake to find a bat in your room, assume you have been bitten. Also, if you find a bat near a person who can't report a bite, such as a small child or a person with disability, assume the person has been bitten. All these factors, that is when you should seek medical intervention or assistance. I will employ us to subscribe, hit the notification bell, and share. Thank you. Some of us will be wondering, how common is rabies? According to WHO, it was estimated that around 59,000 people died of rabies worldwide every year. However, the actual figure may in fact be much higher due to unreported or undocumented cases, especially in Asia and Africa. Data on the situation in Europe is as follows. Germany has been considered, such as Switzerland, France, and Netherlands, also rabies-free at a point in time. However, there is continual risk of infection from bites from wild animals and dogs when people travel to Africa, Asia, South America in particular. In 2019, there was 4 documented cases of rabies in Europe that occur as a result of such vacation trip, and all prove fatal. In the meantime, I'll be sharing with us animals that can transmit rabies, because it's not only limited to cats, bats, and dogs. I will be sharing, but before I do that, I will employ us to subscribe, share, and hit the notification bell. Such animals are classified into 2. The first class is the pet and the farm animals, which includes cats, cows, dog, ferret, goat, and horses, while the wild animals include bats, coyotes, foxes, monkey, raccoon, and wood chunks. I will be sharing with us how rabies is diagnosed. If the doctor suspects rabies, they first ask for the person's previous history. As the person stayed in a high-risk area, have they had contact with animals? A lot of questions asked by the doctor just for confirmation. However, despite the many advances that have been made in the diagnosis of rabies, the problem remains that there is little to no evidence. Risk factor that can predispose an individual to rabies includes the following: traveling or living in developing countries where rabies is more common. Second, activities that are likely to put you in contact with wild animals that may have rabies, such as exploring cave where bats live, camping without taking previous precaution to keep wild animals away from your campsite. How do we prevent rabies? But before I talk on that, I want you to subscribe, share, and hit the notification bell. Vaccination of pets and animals. Keep your pets confined, keep your pets inside, and supervise them when outside. This will help keep your pet from coming in contact with wild animals. Protect small pets from predators. It is very important to report straying animals to local authorities. Call local animal control officer. Also, don't approach wild animals, especially when you don't know where they came from. Keep bats out of your home. Seal any cracks and gap where bats can enter your home. If you know you have bats in your home, work with a local expert to find ways to keep bats out. Finally, consider the rabies vaccine. Consider taking rabies vaccine if you are traveling or to high-prone area, or you are coming from high-prone area. In the moment, I'll be sharing with us how rabies is treated. In the past, the bite of rabid animals was considered a death sentence. However, today it is possible to save the life of a person who has been bitten through timely vaccination administered after the bite. However, if the person has symptoms, it is too late. Therefore, it is extremely important to see a doctor immediately when rabies is suspected. In view of this, treatment generally follows the following step below. First, wash pathogen out of a bite or scratch wound. Secondly, immediately and thoroughly clean the wound with soap and water. If it is a deep wound, it can be flushed with a catheter. However, the wound should not be cauterized or stitched up. People suspected of having rabies are immediately admitted to a hospital intensive care unit following these immediate measures, the suspicion of contact with rabies is confirmed. Treatment for people bitten by animals with rabies. If you have been bitten by an animal that is known to have rabies, you will receive a series of shots to prevent that rabies virus from infecting you. And if the animal that bit you can't be found, it may be safest to assume that the animal has rabies, but this will depend on several factors, such as the type of animal and the situation in which the bites occur. The rabies shots include a fast-acting shot to prevent the virus from infecting you. This is given if you haven't had the rabies vaccine. This injection is given near the area where the animal bites you, if possible, as soon as possible after the bite. But if you haven't previously had the rabies vaccine, you will receive 4 injections over 14 days. But if you had had the rabies vaccine before, you will have 2 injections over first 3 days. But some of us will be wondering if all the animals have rabies, or how do we determine if an animal have rabies? There is standard procedure for that. But before I share that with us, I would like us to subscribe, share, and hit the notification bell. Thank you. Procedure for determining whether an animal has rabies vary by the situation. For instance, for pet and farm animals, example, cat, dogs, etc., that bites can be observed for 10 days to see if they show signs and symptoms of rabies. If the animal that bites you remain healthy during the observation period, then it doesn't have rabies and you won't need rabies shot. Other pets and farm animals are considered on a case-by-case basis. But it is important for us to talk to the doctor or local public health official to determine whether you should receive rabies shots. Then the second way is for wild animals that can be or found or captured, such as bats that came into your home, can be killed and tested for rabies. Tests on the animal's brain may reveal the rabies virus. If the animal doesn't have rabies, you won't need the shot. Then on the third category is animal that can't be found. If the animal that bit you can't be found, discuss the situation with your doctor and the local health department. In certain cases, it may be safest to assume that the animal had rabies and proceed with the rabies shot. In other cases, it may be unlikely that the animal that bit you had rabies, and it may be determined that the rabies shots aren't necessary. However, these are some of the things you can do in the meantime. Wash your wound gently and thoroughly with soap and generous amount of water. This may help wash away the virus. This is precautionary measure. If the animal that bit you can be contained or captured without causing more injury, do so. Do not kill the animal with a blow or a shot on the head, as the resulting injury may make it very difficult to perform laboratory tests to determine whether the animal has rabies or not. Finally, preparing for doctor appointment. These are the following you should know or prepare to take to the doctor. If an animal bit you, seek medical attention for the wound. Also tell the doctor about the circumstance of your injury. The doctor will ask you the following question: what animal bit you? Was it a wild animal or a pet? If it was a pet, do you know who owns the pet? Was it vaccinated? Can you describe the animal behavior before it bit you? Was the animal provoked? Were you able to capture or kill the animal after it bit you? These are the likely questions the doctor is going to ask you. So you should have this at your fingertips before you go for the doctor's appointment. Thank you.